Good evening, everybody. This is Dr.Apurv Mehra, and I welcome you on behalf of Conceptual Orthopedics for this talk, where we want to discuss about the book called as Concepts of Clinical Examination in Orthopedics. Majority of the books which have been written in clinical examination are single-authored books, where there have been contributions to different chapters. But in this book, the chapters have been authored by different teachers. For example, if we look at the spine, that has been written by Professor Tuli, Professor Kumar. If we look at hip, they are carefully being written by Professor Dal, Dr. Dimri, and clinical examination of newborn is being written by Professor Gopa Kumar. So that's how the books have been written. And then all the chapters have been verified by multiple teachers. I will like to show you some important things that will make you understand what I'm talking about. When I look at the important things in Trendelenburg test, where you should be looking, where you should be gazing, these are the things which are commonly asked to you. In this book, you will be able to find out that the examiner is sitting, he is looking at what area, the gluteal fold or what areas, and how much time should the patient be able to stand, minimum like 30 seconds mentioned here. Then we'll be talking about marking important things so that you can understand the commonly asked thing. What's an axillary disc? What's a disc in the shoulder? How do you understand the list? Right? And then something like a Froment sign, which while reading, I discovered that if you give a too thick book, then everybody will probably have a prominent flexion of the flexor pollicis longus. And these are the things in the book that you'll be understanding. Our teachers have themselves taken the photographs. This is Dr. Harpreet doing the examination of the shoulder for different tests. These are the hands of Dr. Nawful talking about different tests around the wrist joint. And you will find out the important areas being marked, like the anconius triangle being shown here. Right? So these are the things that you will find, which you will struggle sometimes. And I think this is a book which is created with the thought that you will always carry this book to the wards in the presentations and develop a habit of doing these things as you examine the patient for better understanding. You will find some important tables which we always need. And this chapter, I think you'll be loving it. The examination of the newborn and the evergreen and very, very strong pillar of conceptual orthopedics. We have two chapters by Dr. Shailesh Pai on the classifications of upper limb and lower limb injuries. So these are some things that you always need when you are in the ward. I will not further like to hide this thing that we have so many books in India. And what difference will this book get to your preparation? This is what I want to talk about. Our aim is not to give you another 200, 300 page book, which you just keep in your room or keep in your bag in the wards. We are developing a system in conceptual orthopedics that you do the book with us. So from the mid of May, that is when the books will reach you and you have some time to read the book. From the mid of May, we'll be sharing a schedule with you where you will be told that there will be a session with the author. So there will be senior teachers who will be answering the doubts that you have from the book. So you read the chapter of the book, keep your doubts ready if you being available in the session, or if you want to mail, you can mail the doubts which we will clarify. Then in the session, the live session with the author, he will take you through the book, through the chapter, what are the salient points to be mentioned, what do you speak, where do you make the mistakes. Our premium subscribers will be entitled for this discussion on the prior selection. The students who have been very regular with Conceptual, they will be given the first chance. If they agree to be a part of this discussion, they'll be the first choice. If not, any premium subscriber can give the name. It's like the loyalty points that you earn. The more sessions you attend and you are present, because we keep a record of every session, the more are your probabilities that you'll be included in the future sessions. And then obviously, that goes without saying that these sessions will be recorded and they will be put on the app. But when this is the second discussion, but I believe that this is a golden opportunity where the students will be having one-to-one session with the authors, right? And we'll be able to make some changes or edits whatsoever if any human error is there in the book. So we want it to be a two-way process rather than a book that's printed and sent to the student and then he is not able to carry on further if there is any doubt. Apart from that, we are developing an MCQ book. This MCQ book is a separate book which will be given to you. I always believe, being into the MCQ world for last 12 years in India, that if you know how to solve the questions, your clarity of that topic is further enhanced. And many of you will be writing fellowship exams, super specialty exams in the future. So our team is working on the MCQ book. I will request Dr. Nauful to explain about what kind of book he's developing with us. And the book that Conceptual is giving to you is again a part of the package that you have taken. Courier charges are by the students, but we are not going to charge our subscribers for this. So Dr. Nauful, can you tell how the students will, what will be in the book and how it will benefit the premium subscribers of Conceptual Orthopedics? Dr. Nauful Nahas.
Thank you, sir. Like Dr. Apurv has already mentioned, along with the examination book, all our premium subscribers will be getting an MCQ book also, on which we are working since the last few weeks. So we have around 26 chapters in our Conceptual Orthopedics app, under which we have created videos and notes. So under the same headings, we are trying to make MCQ questions. And for all these 26 chapters, each chapter will have at least a minimum of 100 MCQ questions, and which will be prepared by most of the senior faculty in our Conceptual Orthopedics. So each session will have around 100 questions. That means almost close to 2,500 questions we'll be able to bring it to you. And this will include the major sessions like trauma, spine, hip, arthroplasty, and most of the topics which can come for your fellowship, pre-fellowship exams. So we'll be giving this book to you, and we'll try to keep sessions so that we can discuss the topics with you and how to solve and what all doubts you have we'll be able to clear in the upcoming sessions. So that is what we have in plan for you guys. Yes, sir.
Thank you very much, Dr. Nauful. And there is one more book. This book will be ready by this month end. So you will expect to get this book very soon. You don't have to do anything extra. Our team will ask the detail and courier it to you. Right? Only the courier charges have to be paid by the subscribers. Next is a trauma book from the man, Dr. Shailesh Pai. Sir, please brief the students about how you are developing the book. Dr. Shailesh, sir.
Yeah. Thanks, Dr. Apurv. What was felt as a feedback from many subscribers was that reading for the exam point of view for trauma is a little difficult, because trauma covers substantial part. You know? Even in DNB papers, what we are seeing is about 25% of the questions, 1/4, that is about 15 questions are directly from trauma. So with that in our background, with that intention, we are developing a book, because trauma is one such thing. What we feel is the things that are described in your standard textbooks is little different than what most of us do in day-to-day practice. So that's where the student gets confused as what to write in their exams, right? So here we are planning to get a book which gives in details about all the principles and all the various treatment options available. Okay, so that way we are giving a broader vision to the student, and he could, easily answer any question that is asked. So what you're planning is sections on the principles of bone healing, the principles of fixation, reduction techniques, and then individual chapters about each of the fractures. And with that, at the end, we will also have separate chapters on implants and instruments with respect to trauma. So that should cover most of the things with related to trauma. And I'm sure with that one book, you could have a quick revision and also could understand the principles, so that you could, it will definitely help you for your exams as well as when you want to treat your patients further. Yeah, so
Right.
that's,
And the most important thing, you have the man, Dr. Shailesh Pai, to talk about each chapter. So that, sir, you can also plan sessions according to the chapters that you're making for the doubt clearing sessions. Because I think most of the trauma things are already covered. But then, even if the students have doubts, we can take maybe 3 to 4 chapters at one time, and whatever doubts they have, they can mail to us, and we can further enhance. This will work as a double-edged sword. One, the students will read. Second, they will keep us on toes to further improve in the next editions of the book, because this is how we can evolve gradually. And friends, as you know now, the MCQ books and the trauma books are being under formation. Your suggestions are welcome. If you want something to be included into it, please mail us whatever is required you feel that we should add into it. This is what we feel. And now I'll take you to Dr. Harpreet. Since there are many non-premium subscribers also in this session, why don't you tell our students how conceptual orthopedics can help them in their MS and DNB exams? Dr. Harpreet.
Thank you, Dr. Apurv. So, conceptual orthopedics is just not any other regular book or a app which tells you just gives you information one way. So I was just saying that we are always there to guide you as a friend through your exams, DNB and MS exams, and throughout your career. So for those who have not still don't have the full version of the app, we have more than 600 plus videos, more than that notes, pearls, and we have live sessions to help you through different topics and exam related topics, and also practical topics which you problems which you face during your clinics. So for all the subscribers, and for not all, for also for the not the premium subscribers, we are there to help you out. But you have to tell us what are the problems you are facing. For all the premium subscribers, you already have written to us that these are the topics you want us to cover even in more detail. So our senior faculty is already working on it. You saw last week Dr. Dimri came up with that excellent talk in his series of talk on DVT and thromboprophylaxis. So it will be 3 talks on that. That was just the first part of that. Dr. Dhal is already having live sessions every week on various topics. He'll also be coming up with few interesting exam related talks which have been suggested to us by our students. So it's just not a one way traffic. It's always what you want, and we'll try and come up with the solutions for your problems. So thank you for having the trust in us, and we hope to deliver on that trust. And to all the subscribers who passed with flying colors in today's results, congratulations to all of them.
Thank you, Dr. Harpreet. Now I'll tell you, we have Dr. Rohit Prasad. Dr. Rohit is one of the initial subscriber of Conceptual. He passed his exams. Now he cleared almost every SRship exam that he appeared for. And he continues to be evolving and being involved with Conceptual. Dr. Rohit, can you guide students how to optimally use this platform?
Yes, sir. Thank you, sir. Good evening, everyone. And I think the first thing that I want to say is that this app has helped me and in a lot of way that I can't even put in words. And even though we have this initial struggle of passing our MS exams, and once we pass this exam, we have another struggling phase of entering into this SR-ship. We though we don't have any idea as to how much struggle we have to face, but ultimately when you come to the I think maybe it's a part everywhere where you have to give exams, you have to give either a written exam or a viva, and so you will have to be updated, and you have to know most of the things that is most of the time in a viva is asked as a clinical case. And they usually ask about what are the most commonly cases that we see. And so what I used to do was every time before appearing into any viva or any MCQ exam, I just used to go through whatever the important topics we had in through the conceptual orthopedics, and it has been till now the perfect thing to me, because I have been able to answer most of the questions that has been asked in viva, and hence I never had any problem clearing any exams till now that has I have been able to appear. So what I can tell is that please go through the app as has been the sections. For example, most of the time we always come across whenever if you are practicing, if you are in a third year or a final or maybe in a second year, before going to OT, please go through the lectures that Shailesh Pai has talked about, because most of the time we struggle in trauma. So please go through the lectures and even the intro videos that he has made, and hence that will clear all your doubts, and you will never be in a dilemma as to what to do with a patient once you encounter such. Similarly, if you are going to give a particular exam, what I used to do was I go through the app. There is a very beautiful talk of arthroplasty sessions, and just go through it, and I think it takes just 3 hours or 2 hours, and that's it, and your knowledge up to par. So I think what we need to do is, before appearing for any exams, after studying all the books whatever you have, but from my point of view, I always what I do is that I just go through the app, and whatever the weaker section that I know that I don't have a good concept about, I just go through those things, and then it just takes few minutes to clear all your doubts through it. So this is my point of view that I can tell, and I think we need to be very actively participating in such app, because these are one of those things that we never should miss, and keep participating and keep adding into it, so that it can become one of the best thing that has ever happened for our orthopedicians. Over to you, sir.
Thank you very much, Dr. Rohit. And now I'll request if any of our subscriber or any of our user or anybody present here has any suggestions or requests to make. You can unmute yourself and please talk to us. I'm waiting. Anybody?
Good afternoon, sir. Can I talk, sir?
Yes, Dr. Mukil, please, you're most welcome.
Sir, I want to thank all of our teachers, sir, really, because I want to say this. After joining, I am a DNB candidate, sir. After joining my institute, here the case load is very, very less, sir. And I'm into severe depression, sir, after that. Whether to leave this course or whether to continue this course, I was in a severe confusion, sir. There is no academics at all, no teaching, nothing, sir. Then I used to beg my teachers, please teach something to me, but nobody used to bother about me, sir. It's a pure corporate hospital I was working. I don't want to mention the hospital name. And yeah, and in between, when I know this app is there, once I subscribed to this, and I had a feeling that whenever I used to see a good MS candidate in a very big institute such as Mansi Medical College, or even I am in Bangalore. In Bangalore also, in Sanjay Gandhi Institute of Trauma and Orthopedics, I hesitate to go to external posting, thinking that oh, why can't I crack this seat? I landed up here since I don't like that inferiority complex. Everything is there inside me. But I want to tell this after subscribing this app, sir. I whatever I want to learn. I learned everything from all the videos. I have communication problem also. I don't know to speak fluent English also there. And I don't have, literally I used to drummer when I used to communicate with the teachers also. I'm afraid of, I'm that kind of person. And in between I tried for second time exam also, for NEET exam also I wrote, I tried, also I'm not able to do. Simultaneously I have to do this job, continue my DNP course, and this is very difficult. So how to come out of this depression? I was like that. Nobody bothers about me. I'm the only PG here, sir. Here that cancelled the DNB seat also by the national board. I'm the only PG, but I'm doing final year now. But I'm the only PG here. I'm from the first year. I'm the only PG. When I joined, they cancelled the DNB seat also. Then once I entered into the app, then daily full time no cases will be there, sir. Per day 20 to 35 OPDs will be there. Hardly per month 15 cases used to happen. I will be the third assistant because for each and every cases two surgeons will be there. This kind of exposure, how I am going to operate, lot of things I used to have, sir. In between this, I am standing in between the walls. At that time, the only faith, whatever knowledge I gained is only from this app. This app for others, it is just to gain the knowledge. But because of this only, I completely came out of my depression, everything. Now I'm happy since I also know something. I also can answer something in future. If I don't have proper surgical skills, also during SRship, I know the basic principles, whatever is required. I learned from the legendary teachers also, sir. After coming to this app, and then only I literally came out of all of my depression. I learned something. Now I have some confidence. I want to practice. I want to do good, become a good orthopedician. I want to crack FNB, hand and microsurgery in future, sir. Since I am not able to achieve these things now, I landed at this institute here. So another entrance exam. I'm interested in hand surgery. Another entrance exam I have to appear. Like that and all, I have lot of dreams. So everything I got my all of my confidence after entering this app. Now I'm very happy, sir. Daily I used to whatever DNB questions are asked, I used to take notes. Used to make my own notes. I used to revise that. I will have the satisfaction. At least they am not wasting my days. At least I am doing something. Whenever my corporate hospital, whenever they used to operate, I will be the third assistant. I will watch for all the cases. I used to see. I will able to understand what they are doing since I am reading from this app. My best motivational teacher is Apur sir. I used to watch his all motivational videos, and the best thing I like in Apur sir is do good to feel good. That is what sir used to say. So here, when somebody teaches me, I used to see them like God, because no teaching program at all. But I am able to get continuous teaching, academics, everything from this app, sir. Now I told me, even I told my parents my DNB course will be 5 years. Since I decided myself that definitely I'm going to fail. But now I had little confidence that I can pass in first attempt also, sir. I was gained a lot from this thing. Literally, I want to tell this, that since I got the opportunity, I told this, sir. Thanks a lot for this, sir. I will never. This is a very great help for me. Please guide me for to pass the DNV examination, sir. And I want to appear for the FPT exam. And I want to crack hand surgery. I want to do something in my life, sir. The confidence, the lighthouse is this app for me, sir. I was thankful for all the great teachers, sir. When I saw the legend teachers, if I cracked a very big seat, I would have got in the same MAMC. But now also, I am also a student of MAMC, teachers from MAMC. In that way, I was satisfied myself and I was very happy, sir. So thanks for that. Thank you, sir.
Fantastic. Mukel, I will tell you something. I want to tell you one thing, that although everywhere in Conceptual you will see my name coming up, but am I audible?
Voice is breaking a little bit.
You're audible.
Is it better now?
Yeah, you're audible.
Is it stable? Yeah. Although in everywhere in Conceptual it appears that Dr.Apurv Mehra is there, but if at the back of it, and Dr. Shailesh Pai would not have been there, trust me, we would have really struggled. So I am just standing on the stage that these people have built. And apart from that, the kind of team we have, the marketing team and the support team, that deserves mention. Plus, what I've learned from Dr. Tuli, I'll share. I will start recording with him at 9:30. At 11 o'clock, I will look at the watch and I want to have water. But when you look at his face, he's okay, let's go ahead. And he's 89. And that is what tells you that this system can't fail. Mukil, I'll tell you one thing. If I had known what you know today, I would have got many medals during my residency. I was talking about you to Dr. Dhal that day, and I was telling that after a few years, India will know your name and maybe beyond. But stay grounded. You know, career building is every day of your life. The moment you are lax, it's gone. It's like the air in the balloon. Zoom, boom. Right? So you have to be very cautious. And when I look at now, when I reach the center every day, the clinic where we work, I see Dr. Naufal with his head down and working on your notes, your MCQs. You don't have to tell him again that this has to be done. And he's somebody who has a brain. You know that his brain is better than yours. He's giving you the inputs. So you know that the future of Conceptual is in safe hands. Then you have young people like Rohit coming from bottom to up. In fact, our students who are passing now are joining the family. They are helping to strengthen our content. One of the students, Dr. Dipendra, has agreed to be a part. You people will remember Dipendra was one of the students who was there in the sessions. Mukil, Dipendra was with you answering. 5 days back, he cleared his exam. And he's joining us in making our content. So it's a process, you know, we are evolving together. So it is just not right now you're speaking like a student. Tomorrow also you'll be a student, but speaking like a teacher as well. That's how Conceptual is. It's like a family, right? And the books, I'm sure you will love it, but we will love that if you use them. Anybody else who will like something to add to? Dr. Nagarjun, Dr. Shubham, Dr. Sharad, all these students have been in touch with me. Sharad, I hope that you'll be very happy with the MCQs that we are developing. Sharad was, in fact, the first person who told me, ki, sir, we want you to do MCQs. Why don't you share your views on the MCQs that we are developing, Sharad, and the book that we are giving for MCQs?
Sir, are you able to hear me?
Oh, yes.
Good evening, sir. Sir, I remember the day it was in September, October when I suggested you, and you, I can't even imagine that it was just, at that time I did not expect that you would be so enthusiastic about our suggestions. And I was really glad at that time itself you said that let's do it. And I was like, I was so surprised that being such a renowned faculty in orthopedics, being the owner of this app, you are so much into it that you want this to improve to that much extent that even smallest of our suggestions you are taking. And sir, I know that I have called you many times. Almost every time you have picked up my call, and even some of the time when we could not contact you, called me back. So, sir, that's really, I don't have that much words to express my gratitude for that.
Get me a medal. Get me a medal, Sharad. If you want to return a medal.
Yes, sir. I promise.
And you know what's your medal? Become an ethical surgeon. There is no system which can honor an orthopedician. An orthopedician honors the crowd that he's into. But become an ethical surgeon.
Yes, sir.
Learn what our seniors have been doing.
Yes, sir.
You have to be apart from the crowd, right? And as Mukil has said, this is the biggest medical college that the world would have ever seen. And we are all together as a student into it.
Yes, sir.
Thank you for the emotional words you have spoken. Anybody else who would like to contribute here? Anybody who wants to speak? We are going to do this every Sunday. Because now I think I am at a stage I can say that we are able to provide you about 10% of what we want to do. I can promise you we have not even started. Right? Trust me that as Dr. Mukil said, he was requesting teachers to take a class. Here the teachers will request, come and take a class. So it's the other way around here. Shubham, will you like to say something?
Good evening, sir. Hello.
Hey, good evening, Shubham. We can listen to you. Go on.
The app was very helpful, sir, from starting. Sir, in my I'm the private college, so academic is very poor here, sir. So मतलब बहुत ज़्यादा help हुई sir इस app से, sir. And sir, I think this is not only for the PGs. This is also for the practitioners also. So I have my exam in like next month, but recently I subscribed for another 3 years, sir. So I think this is for the practitioners also, and for the not only for academic, also for practicals and practice also, sir. That's all I have to say.
Shubham. And I'm really happy that you are there in all the sessions, Shubham.
Thank you so much, sir.
And keep attending these sessions. I'm telling you that it will be very, very useful.
Thank you so much, sir.
Right, and anybody else who wants to speak something? Nagarjun is somebody who's always with us.
Good evening,
yes,
sir.
Yes.
Sir, this app has been very useful, sir. From the last 1 year, whatever I have learned in orthopedics, it has been from this app only, sir. And attending the classes and interacting with the faculty and clearing the doubts, whatever we had, and learning new things has been very helpful from the past few months, sir. I would like to thank all the faculty and everyone helping in this app. And I would like to thank everyone, sir. And I feel not only during residency, but all over throughout the life and career, we can learn and help in this app. Thank you so much.
Thank you very much. Anybody else? We can have some more people speaking. Roy Shuddin, will you like to speak? Anybody else? It is your time, boss. Every Sunday is for the family.
Apurv, can I say something?
Oh, please.
So it's always good to hear the good points, but a mentor of mine had said some good words. I will not remember. It's a bit in Hindi. जो आपकी बढ़ाई करता है उसकी तो बात सुन लो, बट जो आपकी बुराई करता है, आपकी कमियां बताता है, उसको कमरे में बुलाओ, चाय पिलाओ और उससे बात करो. So tell us our weak points. It's very good. It's really encouraging to know that we have been able to help our friends, our juniors. We have been able to repay their trust. But again, we are not perfect. We need know where to improve, and we will improve, but we have to have your help with that. So tell us our weak points. This session should be to tell us that this is what you need. This is where we are not strong. So tell us that. We'll humbly listen to your request, to your suggestion, to your criticism, and we'll try and improve on that. So this is a journey, and on this journey we both are together. So let us hold each other's hand and carry on this journey. Thanks, Apurv.
Thank you very much. So anything that you feel we should add on further, anybody? Before I finally close the session, we'll be sending you the links on which you have to put on your address. We'll be confirming the courier charges to you. Once you confirm the courier charges, and we will be sending the books to you. We will start doing the same with you. And anything else, as Dr. Harpreet correctly said, because we can only improve if we know where are the shortcuts. Just let us know whatever mistakes we are doing. And just to revise, Mondays is Dr. Dhal's session. Every Monday, sir will be meeting you. Thursday is Dr. Dimri's session. Twice a month on Saturday is Dr. Greichin from Germany, his session. On Wednesday and Friday is theory support session. And Sunday, we all will be talking to you about developments every week. What we were achieving every month now, our team will be doing it with 34 consultants every week now. From now on, we are going to be very aggressive. COVID is increasing. Please stay safe. But this year, we will not let you feel the gap in your studying. We will have enough notes for you. And if you are not going anywhere on the postings or anything is being hampered, my request and advice, spend time with CEO, Conceptual Orthopedics. I'm waiting. Which session will we have 1,000 students? I am waiting. Because we have more than these number of subscribers now. And there should be more and more coming. And I believe there is not far. We will be very near to this. That's all from my side. Yes, Sharad.
Sir, can we expect all these books to be available by June?
Available by?
June. By June, can we expect that we can get these?
The clinical examination book and the MCQ book will be available in April.
Okay.
The trauma book, Dr. Shailesh, can you tell the time when they can expect the trauma book?
Thank you, sir.
Trauma book. Dr. Shailesh, over to you. Wanted to create some pressure. I am asking you to commit publicly. Look, I'll tell you what. On the trauma book, on the cover page, it will be written Faculty of Conceptual Orthopedics, but inside we all know who's the trauma man here.
Right. It's the team book.
So whatever is being wrong in that book, he's the man. If the book is good, you can talk to Dr. Harpreet and Dr. Noful. So trauma book is what they want to know. But Dr. Shailesh, once 2 books are done, we all are going to support you for trauma book. It's a huge project.
Yeah.
But when can they have the trauma book? The country wants to know.
Yeah, so I will take June as a deadline, and I will see to it that the team works and gets it done.
On Doctor's Day, that is 1st July, you'll have all the books, Sharad.
Okay. Thank you,
If he has said June, I know him. He will give me the things by May.
Thank you, sir.
That's how you request your seniors to work for you.
Thank you.
Right. Rohit, let's get working on this trauma book.
Yes, sir.
You have been in love with his teaching. Your teacher needs him now. So all the very best, and thank you very much. Bye bye.
Thank you, sir. Bye, sir.